Next on In Focus.
She looked at me, she said, "Mommy, my head hurts really, really bad." She was on fire. I called my doctor. He told me that it was a vaccine reaction.
I'm Rich Maneri, and welcome to In Focus. Today we look at vaccines. Under new Pennsylvania state health rules, parents must have their children vaccinated by the first day of school. There used to be an 8-month grace period. Now, children can be granted a waiver of only 5 days to get required immunizations. School districts and the medical community urge parents to have their children vaccinated for their protection and the protection of other children, especially those too young to be immunized. Still, there are some parents who refuse, and we wanted to know why.
When you have a vaccine reaction, they tell you it's a coincidence. They're lying.
Crystal Hunsicker believes immunization should be a matter of parental choice. She is the founder of the Pennsylvania Medical Freedom Alliance, which is pushing for informed consent legislation. She says her daughter Jade, who is now 17, had a severe reaction following her kindergarten vaccines.
I loaded her in the car. By the time we got to CVS, which was a 5-minute drive away, she could no longer walk. 3 days later, Jade could no longer see. She was bumping into things as she walked.
Jade, her mother says, is legally blind from her childhood vaccines. Her vision is corrected with contact lenses.
I remember that realization when I was in 4th grade because I couldn't even see the whiteboard in school.
The opinions of Hunsicker and the so-called anti-vax movement are well outside the mainstream of medical thought, and most of the medical community would argue not based in fact. The American Medical Association fully supports the overwhelming evidence that vaccines are among the most effective and safest interventions to both prevent individual illness and protect the health of the public. The U.S. Department of Health and Human Services says vaccines are the best defense we have against serious, preventable, and sometimes deadly contagious diseases.
The immunizations that we have now are probably, everybody agrees, one of the biggest, most important advances in medicine really in the last 100 years.
Dr. Jill Voluk is a pediatrician with Eden Park Pediatrics, which requires all patients to have up-to-date vaccinations. Voluk says in 30 years of practice, she's never seen a severe vaccine reaction. She has, however, treated unimmunized children for whooping cough, measles, and mumps.
In order to prevent these illnesses, about 90% of the population needs to be immunized. And so when the vaccine rates fall below that is when we start seeing breakthrough illnesses in those areas.
And Dr. Clark McSparron has seen much in his 57 years as a pediatrician. He is now retired, but he still sees images of children suffering because their parents didn't have them immunized. He remembers a particular case of whooping cough.
His 2-month-old younger brother, again too young to be vaccinated, and whose mom hadn't gotten a booster pertussis vaccine during the latter months of pregnancy. This little child developed pertussis and died of the illness because he was not protected at all by those around him.
McSparron says he sees no reason or excuse for not immunizing and protecting children.
It's much better to prevent things than to treat them, and much easier and much less expensive, and it works. That's the science of immunizations.
Still, not everyone is convinced.
Saying that vaccines and one size fits all and it's for your own protection, I believe that's a lie. And I feel that people have the right to choose. They need to educate before they vaccinate.
Susan Love is the co-director of the Pennsylvania Medical Freedom Alliance. She believes there is a direct link from her daughter Sarah's autism to the measles, mumps, and rubella, or MMR vaccine, Sarah received at 15 months.
She was meeting all of her milestones up until that point. She was actually starting to speak. And then after she got the vaccine, she had a fever of 105.7. And then she stopped talking.
But the medical community at large will tell you those dots simply do not connect.
There's absolutely no correlation between the MMR vaccine and autism.
The theory that the MMR vaccine causes autism was propagated by Andrew Wakefield. He's a former physician from Britain who was stripped of his medical license after his research claiming autism was linked to the measles vaccine was found to be an elaborate fraud, in the words of the British Medical Journal. The Centers for Disease Control and Prevention reports that from January 1st to June 17th of this year, 108 people from 11 states, including Pennsylvania, were reported to have measles. Most were unvaccinated. Cases of whooping cough have turned up in local schools in recent years. There are potential side effects that come with any medication, including vaccines, but they are rare. That's why pediatricians locally and beyond will tell you the far greater risk is leaving your child unimmunized and unprotected. I'm Rich Maneri. Thank you for joining us for this edition of In Focus. We'll see you next time.